Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. When it comes to weight loss, losing weight as quickly as possible, although not recommended, is something a lot of people would love to be able to do. But are there problems you could run into if you were to lose weight too quickly? Are they just minor inconveniences, or could they be life-threatening? Let's find out what could happen if you lose weight too fast. First, let's set aside the extreme type of weight loss that elite athletes do for the sake of their sport. This type of weight loss, also known as weight cutting, can see these athletes dropping large amounts of weight very quickly to meet required weight limits. This extreme fasting and dehydration method can cause kidney injury and metabolic imbalances that can be life-threatening if not monitored carefully. So let's say you're a regular person interested in losing weight, and against the recommendation of your doctor, you want to lose weight as quickly as possible. So, you begin a very low-calorie diet, maybe 1,000 kilocalories per day or even less. And being the most disciplined person on earth, you're able to somehow keep that up for months on end. Here's what you might experience. For the first 2 weeks, your weight would drop very quickly, maybe 8 to 12 pounds. Whenever you pop onto the scale, you'd feel great about your progress. Then maybe not so great since you've been exhausted for the past few days or so. You've had a dizzying headache that's been plaguing you for the past week, and you're finding that it's increasingly difficult to concentrate at work. Dehydration headaches are common in very low-calorie diets, as people who suppress their hunger signals may also ignore their thirst signals. Dark urine, dizziness, and confusion are often the early signs of dehydration, as thirst may not be a reliable indicator. As dehydration gets worse, kidney damage and electrolyte imbalances are possible. Although these problems are more likely during extreme weight cutting, it is still possible in people doing very low-calorie diets. Nutritional deficiencies will worsen fatigue due to the fact the body simply does not have enough food to function properly. Using a multivitamin may help mitigate some micronutrient deficiencies, but the lack of macronutrients like protein will continue to be an issue. You now start to become exhausted just by walking up and down stairs. Your muscles and joints seem to ache all the time, and you're noticing that your weight loss is not so fast anymore. You're only losing around 2 pounds per week. You feel much weaker than normal. The body requires a certain amount of energy to function properly, although this value does slowly decrease when the body loses weight. If the weight loss is too sudden, the burning of fat may not be sufficient, and it needs to find other sources of energy, and it begins to burn another available fuel in your body, protein. The muscles in your arms and legs are the main sources of this breakdown, leading to muscle aches and weakness. Metabolism is also decreased significantly during a very low-calorie diet, since the body needs to retain as much energy as possible for essential functions by slowing down non-essential functions. A decrease in metabolism results in a decrease in the amount of energy normally burned per day. You'll find it much more difficult to lose weight due to the body aggressively conserving energy and trying to burn less fat and muscle as a result. So, despite the challenges, you decide to push through. Speaking of pushing through, you realize it's been a while since you've pushed through a stool, and every time you do go poop, the stools are hard to push out, small, and come out like little rocks. You've started developing hemorrhoids from pushing so hard all the time, even though you're only going like once a week now. If you're female, you've also missed your last menstrual cycle by several days, even though you've always been regular in the past. When your period finally does come, it seems to be lighter and more spottier than usual. Constipation is common for many types of dieting, and is usually dealt with by increasing the amount of soluble fiber in the diet, or taking a soluble fiber supplement. In rapid weight loss, not only does the lack of food intake contribute to smaller and harder stools, but a decrease in metabolism also slows peristalsis, which is the movement of your bowels. Less bowel movements equals less poops. Menstrual cycle problems stem from the lack of nutrition during rapid weight loss. Things like iron deficiency can cause irregular menses, which is sometimes seen in patients losing weight too quickly. Suddenly, you feel a sharp pain to the right of your chest, under the ribcage. It extends to the back and you vomit out your last meal. Not good. You call your doctor, who tells you to visit the ER. At the ER, they run some blood work, then immediately send you for imaging of your abdomen, where they find a gallstone. Because the body is being forced to burn fat during a very low-calorie diet, extra cholesterol is being produced as a byproduct, which is secreted into the bile. Cholesterol is normally broken down by enzymes and flushed out of the gallbladder as bile, but too much cholesterol can overwhelm the enzymes and cause the extra cholesterol to crystallize into gallstones, especially since the rapid weight loss can also slow the emptying of bile from the gallbladder. Gallstones from rapid weight loss occurs sometimes in obese patients who undergo weight loss surgery, such as lap bands or bypasses, since the rate of weight loss can be so quick. Eating more healthy dietary fats and oils during the weight loss period can help reduce the risk of gallstones forming. So how fast is too fast? Most issues with rapid weight loss occur if the weight loss is sustained over weeks. So while most experts recommend aiming for 1 to 2 pounds per week, this is more of a running average. There's no need to panic if you end up losing 7 pounds in your first week, as long as the drop is not sustained over the next few weeks. You can track your weight loss over a few weeks, then calculate your average weight loss per week. If you're averaging 3 or more pounds per week, it might be too fast. Rapid weight loss is often associated with overly strict dietary regimens, and you might experience rapid weight gains once you stop the diet. Instead, consider focusing your efforts to improve the variety and quality of your foods, and create a diet that you can follow long term so that any weight you do lose is much more sustainable. Let me know in the comments down below if you've tried losing weight really quickly and how that turned out. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss tips on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.